Welcome, everyone. Good evening. Thank you for joining us. My name is Dr. Sheila Cohen-Furr. I'm a practicing psychologist in Boca Raton and a member of the Rales JFS Board of Directors. Through the generosity of Norman and Ruth Rales Foundation, we've been consulting with Dr. Susan Lehmann since last year as we're establishing a more robust psychiatry practice here at JFS, including partnering with Florida Atlantic University's Smith School of Medicine to establish a psychiatry residency program. Dr. Susan W. Lehmann is the clinical director of Geriatric Psychiatry and Neuropsychiatry and an associate professor in the Department of Psychiatry and Behavioral Medicine at the Johns Hopkins University School of Medicine, where she oversees geriatric psychiatry clinical services at the Downtown Hospital and Bayview Medical Center. She directs the Geriatric Psychiatry Outpatient Clinic and Geriatric Psychiatry Fellowship at Johns Hopkins. She's a national leader in geriatric psychiatry and in medical student and geriatric psychiatry education. She directed the Psychiatry Clerkship for the Johns Hopkins School of Medicine for 15 years and is a former president of the Association of Directors of Medical Student Education in Psychiatry. Dr. Lehmann is interested in improving medical student and general physician education in geriatric mental health. Dr. Lehmann is the recipient of a number of national awards and has presented and led symposia at the annual meetings of the American Association for Geriatric Psychiatry and the Association of Directors of Medical Student Education in Psychiatry on topics related to medical education, aging and ageism, and geriatric psychiatry. In addition, Dr. Lehmann has published articles, book chapters, and online educational materials related to a variety of psychiatric disorders in geriatric patients. She is particularly interested in late life mood disorders, especially geriatric bipolar disorder, mental health concerns in older women, and outpatient management of geriatric patients with psychiatric disorders. She is co-editor of the recently published book, Bipolar Disorder in Older Age Patients. This evening's webinar with Dr. Lehmann is specifically directed to families and interested parties with aging loved ones who have been affected by COVID-19 pandemic. The title of this presentation is Challenges During COVID-19, How to Sustain Positive Mental Well-Being for Aging Family Members. At the conclusion of Dr. Lehmann's presentation, there will be time for questions. We ask you to please post your questions on the chat section of this Zoom call. And if you'd like, let us know where you're from. We have people here from all over, so you can include, if you'd like, your geographic location. And I want you also to know that we're recording this presentation and the slides will be available afterwards at your request. We'll post in the chat room where you can write an email if you would like this. Thank you. So please keep yourselves on mute so we can hear everything that Dr. Lehmann has to say. And on behalf of the Board of Directors of Jewish Family Service, please join me in welcoming Dr. Susan Lehmann.
Thank you so much, Dr. Furr. It's a pleasure to be here today with all of you and talking about a topic that I think is important. The title of the talk today, as Dr. Furr mentions, is Challenges During COVID-19, How to Sustain Positive Mental Well-Being for Aging Family Members. But in point of fact, I really will be talking today about aspects that relate to all of us in sustaining our mental well-being, because we can't assist other family members without thinking about ourselves as well. And because the challenges of the current pandemic have been ones that we've all experienced, and they've all affected all of us. So today I'm going to be talking to you about the specific mental health challenges that I've seen as a psychiatrist affecting my older adult patients and their families. I'm going to specifically address some coping strategies for dealing with loneliness, depression, anxiety, and the particular challenges of helping a family member with dementia. And I'm going to be focused with you tonight on how we all can stay socially connected while physically distancing. Last week, there was a town hall at Johns Hopkins led by the president of the hospital for all employees. And he started out his talk by referring to 2020 as the year that changed everything. I think that that is a very appropriate way, among others, that we might describe the year 2020. For me, I think the next cartoon was one that I saw a number of months ago and actually captures how we all felt at the beginning of the pandemic. You'll see the fortune teller is looking at her crystal ball, which now looks like the symbol, as we know, of the COVID virus, as we now recognize it. And she says, one day it looked like that, and now I have no idea what the future holds. I would say, when the pandemic began 10 months ago, we had no idea what the future would hold. And for those of us working in healthcare, the first weeks, the first months were adapting to a changing reality that happened day by day, week by week, and in the early months, month by month, as we were learning what's the extent of the virus, what kinds of problems we were facing, and what we needed to do in order to adapt the way we all were working and the way we were caring for patients. 10 months later, as where we are today, I have to say that we have a better sense of where we are. We know more now than we knew 10 months ago about how to manage of the situation and what things are effective and what things aren't. And particularly, this is a very auspicious day today, as I'll talk about later in the talk, because as you know, the first vaccines were started to be given today. And so we don't exactly know what the future holds, but we have a better idea that where we're going and what we're heading to, and hopefully we'll be seeing over the course of the next year work towards the end of the pandemic. But there's no question that the COVID-19 pandemic, while it has affected everybody in the world and throughout the country at all age groups, has had a very significant, disproportionate impact on older adults. How so? Well, we know that older adults, number one, are at increased risk for getting COVID-19 because a number of chronic health conditions we know increase risk. These include diabetes and high blood pressure, conditions that are much more prevalent among older adults. We know that this is a highly contagious virus, spreads very easily among people in close contact, so close that we've been told over and over again the importance of the physical distancing, 6 feet, that if you are closer to someone in an area of less than 6 feet without a mask, high probability of acquiring the virus. So individuals who are living in congregate living situations particularly are at risk. Those in nursing homes, assisted living, retirement communities. And we remember back in March that the epicenter of the virus when it started was at a nursing home in Seattle, Washington. As well, older adults are at increased risk for developing complications if they get sick with COVID-19. Complications that are respiratory, but now we know months into it that COVID-19 affects multiple organ systems besides the respiratory system, including the brain, and that there are neuropsychological and neuropsychiatric symptoms as well. We know that there is increased mortality of COVID-19 among older adults. There have been high rates of mortality, especially among nursing home residents, as you know, so much so that the highest priority for the vaccine, as you've heard, will be not only healthcare workers, but residents of nursing homes. And in fact, 20% of deaths in the United States have been in nursing homes, which is remarkable when you think about the fact that 80% of the deaths have been in adults over the age of 65, yet less than 5% of adults over the age of 65 live in nursing homes, and they account for 20% of the deaths. So this has been a very high risk situation. We all now know that there are particular things that we need to do that really help mitigate transmission of the virus. These are things we've heard about, and 10 months into the pandemic, we know them well. We understand the importance of wearing face masks to diminish risk of transmission of the virus, of frequent hand washing, of the importance of, I prefer to call it social distancing, or physical distancing rather than social distancing, because, but we often hear both terms. We also know that in order to contain spread of the virus, it's important to isolate and quarantine individuals who may have been exposed to the virus for 14 days. Perhaps now the CDC is saying 10 days under certain circumstances. And from a public health standpoint, these guidelines have been put into place to protect us as well as to protect the most vulnerable among us. But as well as the COVID-19 having an impact on mortality and on morbidity due to increased risks of getting the virus, there has been, I would say, a disproportionate impact on older adults on social and family relationships. For all of us of all ages, we have all been impacted by the pandemic on family gatherings, getting together for birthdays, for milestone events such as graduations, weddings, funerals. But it's a huge impact on grandparents. If I could see all of you and we were here in person, I probably would ask for a show of hands of how many of you are grandparents in the audience and have been impacted because you haven't been able to see a new grandchild. You haven't been able to get together with your grandchildren. You haven't been able to hold your grandchildren. There's been a huge impact on communication because with the distancing that we have had to do, there's been more of a reliance on other forms of communication, on social media, on phones, on videos, on modalities like we're on today, on Zoom. A disconnection from community resources. The activities that were part and parcel of everyday life have been disrupted, from religious services to athletic activities, to clubs, to senior centers. And social distancing, the need to be physically distant, has led to all of us, and particularly our older family members, to be distant from not only family, but also friends that they used to spend time with. Back on Mother's Day, this was a cartoon that came out, and at the time it was very cute, talking about how here's the grandmother the family was celebrating Mother's Day, wearing masks on the sidewalk, showing signs. And this was kind of cute and had a chuckle. But how many other holidays have gone by since Mother's Day in May where this scenario has played out over and over again because families can't be together? And we just had Thanksgiving, which was a great example, and hopefully many families did adhere to public health recommendations not to be together with other family members who were outside of your immediate household. So there have been a lot of poignant stories. And here is a photograph of a woman hugging her mother through plastic. I'm not quite sure how that happened, to show that we just have lost the sense of being able to touch each other. And what a terrible toll that has taken on all of us. We all feel it. I've even heard some of the commercials on TV talk about save up all your hugs and how we're going to want to hug each other when the pandemic is over. How more so we've all felt this way for those of us with our older family members. And as well, the policies that we have had to be put in place from a public health standpoint have disproportionately affected older adults. And these have included prohibiting family members and other visitors from coming to assisted livings, nursing homes, and visiting individuals in hospitals. Now, there was a time, particularly in the summer and early in the fall, when a lot of those prohibitions became more lenient and more lax, when the rates of the virus in many communities went down. And this was true at Johns Hopkins. For a short time, we relaxed our prohibitions about family visiting, but now we are back to a very high level. So if you have a family member who is hospitalized at Johns Hopkins Hospital now on any unit, family are not allowed to visit for any reason. This has led to a lot of difficulty for families. We've heard lots of stories in the news, really sad, touching, poignant stories of patients dying alone in intensive care units, on medical units, because their family can't be with them to hold their hands and be with them in those last moments. There have been heartbreaking stories of couples and spouses separated, where one spouse is in a rehab unit, the other spouse is in independent living, and the more well spouse can't come and help assist the other spouse. So families haven't been able to assist loved ones in nursing homes with what we call activities of daily living, which include things like feeding and eating. Because families have been prohibited from visiting in nursing homes, we've lost what the oversight that families bring as well, not only providing important day-to-day helpful care and the care of their loved one, but checking up to be sure that their needs are being met by the staff. And overall, this has led to an increase in social isolation and loneliness for older adults. This is a particularly sad story that was actually in the Baltimore Sun just a few weeks ago, right before Thanksgiving. The woman here in the picture is holding a photograph of her mother, who was in a wonderful nursing home, getting what she thought was stellar, excellent care. But then the nursing home had to go on a more restricted lockdown when rates of the virus went up, and she was unable to visit her mother. And she said over 3 weeks, her mother's well-being plummeted without her being there to help see her mother, who had advanced dementia, to feed her, to provide contact with her. And she felt that her mother passed away in 3 weeks due to severe isolation and mental, maybe loneliness. She doesn't really even know what happened, but she went downhill very, very fast. And perhaps she thought the nursing home may have been short-staffed and couldn't even provide the care that they had providing before for her mother. She doesn't really even know. So there have been mental health challenges for older adults. I'm going to talk about these 4 areas, particularly as the ones that I have been hearing about and thinking about the most: loneliness and social isolation, anxiety, depression and sadness, as well as the particular challenges of caring for a loved one who has dementia. But before I do that, I think it's important to take a step back and talk about why are these social relationships so important, such that isolation and loneliness can have such a negative impact. So over almost 20 years ago, a very prominent psychologist by the name of Laura Carstensen did some very interesting work, and she was very interested in what happens to social relationships as we age, with normal aging. And in her work, she made a number of observations. And one is, she noted that with the natural progression of time, there is normally what she called a natural pruning of relationships. And if you think about the gardening metaphor, pruning is sort of cutting back of extra dead branches. And what happens is our social networks tend to diminish as maybe people who we are close with move away, maybe they pass away. And so there are fewer people in our social networks. That is part of normal change. But at the same time, she noted that older adults place greater value on the close and meaningful relationships they have, and maybe are less satisfied with the more of the superficial acquaintances that they may have had when they were younger. Now they might have fewer relationships, but they treasure them more and they're more meaningful. And so she noted that she described that a number of other things change with age, that social and emotional functioning actually improve. She called it socio-emotional regulation. So some things tend to change for the better. This is natural as part of aging. Of course, some elements are also happening that make it more difficult: hearing impairment, chronic illnesses, changes in mobility that make it harder for people to get together, as well as cognitive impairment. Of course, these can impact social relationships in a more challenging or possibly negative way with age. At the same time, we've had many decades of research, even before the pandemic, that have indicated to us that there are actual negative effects of isolation and loneliness on health. Studies have indicated that social isolation and loneliness actually increase risk for coronary artery disease, and by such then increase risk for stroke, heart attack, increased risk for dementia, and increased risk for what's called all-cause mortality, which just means that social isolation and loneliness seem to cause an increase in mortality for almost any other cause, that it goes up. They're associated with that. As well, social isolation and loneliness increase risk for depression, or if you have depression, they worsen depression and worsen anxiety, as well as it creates worse general mental health functioning and general overall functioning. So these are two words that frequently go together, social isolation and loneliness. And by social isolation, this refers to having few social contacts or few ties, whereas loneliness is a subjective feeling. It's the feeling of distress, the feeling of deprivation that comes from the sense of being alone, the sense I'm alone and nobody cares for me. I think a key point just to make is that not all people who are socially isolated are lonely, and not all people who are lonely are socially isolated. You certainly can feel lonely in a crowd or in a group of people if you have this subjective sense of feeling alone or feeling there's no one cares about me. But for our purposes, and much of the time, the two do often go together. So what has been the impact of COVID-19? Oh dear. So the impact of COVID-19 has been one that I've mentioned before, which is that on a public health basis, we have to do physical distancing. We at times have to have isolation or quarantine of individuals, people, and from a public health standpoint, this makes sense. In nursing homes and assisted living, particularly if there's one positive individual or resident who has COVID-19, the other residents do need to isolate or quarantine. These are essential for limiting spread. However, the need for physical distancing, if it leads to social distancing and a disruption of social connections, will be detrimental to the physical and well-being for seniors. And so we have two opposing problems where to ameliorate one causes more problems on the other hand. So I want to move now and talk a little bit about anxiety and anxiety during these times during the pandemic. So what forms does anxiety take? Well, there's lots of different types of anxiety, and these are the kinds of topics where I've seen among the adults and the older patients that I'm taking care of. Worry about getting the virus, quite simply. Worry about getting the virus yourself, worrying about your family getting the virus. Worry about family and friends and their health and their well-being. If they get sick, if they don't get sick, you're not able to see them. Worried about how the kids are managing, how are the children managing, who are taking care of children, are the children in school, are the children on Zoom school? There are practical needs. When this pandemic began, we all had to get used to new ways of grocery shopping and getting our food. Many of us had never ordered food online before, and then learned new ways to order from Amazon Fresh and using Instacart. For older adults, they've had to think about safe ways to shop, whether it's online or whether they go to grocery stores that have specific hours, were specifically geared to older people. And then there are practical aspects. How do you take care of your own health needs during this pandemic? Are you going to go for medical appointments? Are you going to see your medical doctor? Are you going to get dental follow-up? Are you going to go to the eye doctor, where you're going to be perhaps in close proximity with the physician? What about refilling prescriptions? I've been hearing a lot of anxiety about local and national news. I think this was particularly acute in the weeks leading up to the general election, and particularly in October. I was hearing a lot from my families and patients, a lot of strain and a lot of stress there was a lot of national discord around the election, as you know, a lot of worries in the country about elements related to race relations that was causing a national strain on the news a lot and causing a lot of stress and anxiety in my patients and the older adults that I know, as well as younger people that I know. What are good ways to manage some of this anxiety? Well, I think number one, a very important approach is being proactive is an excellent way to manage a lot of anxiety that relates to things that you can control through preparation and information. And so when it comes to managing anxiety and worry about the virus, following and implementing the guidelines from the CDC, the Centers for Disease Control, as well as local government guidelines to help minimize the risk for COVID-19 do diminish anxiety. when you use a mask, and you maintain 6 feet distance, stay within your own households, wash your hands, sanitize, people get in a rhythm. I've seen among my patients who are now doing this 10 months into the pandemic, a lot less anxiety about the virus, realizing if they don't go to crowded events, limit their travel, follow safe guidelines for outdoor restaurants or going to houses of worships, there's a lot less anxiety. I see this among my fellow physicians early on in March and April and early May. We had a lot of anxiety as healthcare providers. We didn't exactly know best practices of how we were going to take care of our patients on our inpatient units. And as you remember, early on, there was some mixed messages. Were masks useful? Were they not useful? And once it was clarified how useful they were, and we know that for us to wear our masks and face shields, interacting with patients, we're well protected, our anxiety is diminished as well. I've been saying this a lot to my patients, that we live in a constant news cycle, and how important it is at times I tell people, decrease your dose of news. You don't need to be on the news all the time. You don't need to be on the email. You don't need to hear about it all the time. There's so much redundancy and repetition. You'll hear the important news if you listen once a day rather than constantly. I think it's also helpful to recognize that some of the worries that we're having are normal and widely shared, and perhaps to recognize it's not all pathologic, some of it is actually normal. It also helps to decrease anxiety, to know it's normal to have a number of these worries. An important aspect that I'm going to reiterate probably a couple times during this talk is it can't be underemphasized, the importance of maintaining a good routine and general good health measures in promoting good mental health. And really, this includes the need for routine and structure, having a plan for your day that includes meals, having good nutrition, the same time of the day for eating, and sleep every night. I've seen a lot of people, particularly early on, sort of had a free-ranging kind of a rhythm, circadian rhythm, where they might sleep when they were tired, they might eat when they're hungry, but it wouldn't be the same every day. We know, and there's a lot of body of literature that shows that that really undermines mental and general health well-being, as well as the importance of daily exercise. And I like this little cartoon here because it reminds us the fact that these are two hearts, reminds us that exercise is good for the heart, and the fact that the hearts are focused on the face, that it's also good for the brain. And you can see what is also reminding us that the best exercise actually is walking. And walking is great for stress, it's reduction, it's great for anxiety, depression, mental well-being, cognitive well-being, and for sleeping well at night. Can't go wrong with that. What about depression? I think what I've seen as a psychiatrist is a number of different forms of depression and sadness during the pandemic. First of all, there are some individuals who have a pre-existing depressive disorder. They have already been under treatment with their doctor or with their psychiatrist for depression. There are individuals who have experienced tremendous grief and loss. They've lost family members to COVID-19 or to cancer or to other kinds of normal or other kinds of medical or health conditions. And there's grief and loss at the loss of the friend or the loss of the family member that may have been compounded by inability to be there in the last days, or even to attend the funeral due to COVID-19. There's a lot of general sadness that I think that's been felt probably by nearly everybody, related to missing milestones that we normally would have gone to, the graduations in June, or the Father's Day, the Mother's Day, the birthday celebration, the holidays, as well as the guilt and the mixed ambivalent feelings of not being able to be with family and friends in the hospital, in intensive care units or nursing homes. Even though it wasn't our choice, we couldn't do it due to the regulations. I think it's been very important for me to emphasize the importance of staying in touch with your physician or your mental health provider. Perhaps the silver lining that, and the best thing to have come out of this pandemic for me as a physician and a psychiatrist has been telehealth. Unbelievably, the one thing that changed overnight in our practice in March was the ability to do telepsychiatry and telemedicine with our patients. And the main reason why is because it was deemed a public health emergency, And Medicare and other insurance providers now agreed that they would cover the costs and do it. It's been incredible, and what a boon it's been that I've been able to continue to be in touch with my patients and provide good care for them without them seeing me in person through telehealth visits. It's very important to continue to take medications if they are prescribed and keep on top of them. Be in touch with your physician to make sure you get refills. I do want to mention that this is a time of year that often is a bit of a difficult one. For many individuals suffer from winter blues, which sometimes is also called seasonal affective disorder. And that just means at this time of year, in the late fall and early winter, this is a very real condition that some people tend to get more sad and more depressed. When the days are shorter, there's less natural light, and there really is a physiological reason for this, and there are real medical approaches that actually help. But for those individuals, they could be feeling kind of a double dose of depression and sadness with the seasonal affective disorder, the winter blues, on top of other kinds of strains and depression and sadness they may be feeling related to COVID-19. One way to really tackle depression, whether of all kinds of depression, benefits from something the psychologists call behavioral activation. And that really refers to the fact of changing what you do, and changing what you do changes how you feel. And this means doing the following things: making sure, again, that you have a daily routine and structure. Get up at the same time every day. Go to bed at the same time every day. Ensure that you're getting 7 to 9 hours of sleep. Nutrition, again, is very important. Just last week, I met with a patient and his wife, and they were just eating. He told me they were eating brunch and dinner, but brunch was 11:30 and it was a bowl of cereal. I said, it doesn't sound like brunch. Dinner was maybe a sandwich. They weren't getting good nutrition. Very important for keeping the immune system healthy and keeping our brains healthy is having adequate nutrition as well as exercise. Advocates of behavioral activation, and those include psychiatrists too, we recognize that it's important to try to put in your day and in your week things that have always been enjoyable to you. So often I hear from individuals who are depressed, well, when I feel better, I will do such and such, where in point of fact, what we know is doing more enjoyable things actually does the opposite and improves mood. If you like to watch movies and comedies, watch more movies and comedies. If there are things you like to do that if you like to go on your bike and a recumbent bike, and that makes you feel good, work on the bike and work that into your day. And sometimes that means pushing yourself to do things you know you normally would enjoy. And after doing it, you'll feel good about it. Working towards a goal. Sometimes just even accomplishing chores at home can make you feel you've accomplished something and you've done something for the day. I think that also works towards alleviating stress and anxiety and improving mood. What are signs of depression that would be significant and that should prompt a medical appointment, either for yourself or a loved one? Well, I would say to me, number one really is this, that really is a signal to me. If there is a loss of pleasure in doing activities that were previously enjoyed, and that you can't be cheered up by doing things you used to enjoy, which is getting a good meal from a restaurant, eating food, having cake, things, even a dish of ice cream, or watching that movie that you've always loved, that's worrisome to me. Connecting with the grandchildren, if they don't bring you pleasure anymore, that's a sign that something is really off with this kind of, with depression. The term that we use for it in psychiatry is anhedonia. Difficulty falling, and for me, particularly staying asleep, is a worrisome sign. Individuals who wake up particularly at 3 a.m, can't go back to sleep. The tapes are running in their head. They're anxious, they're ruminating. That's a worry. Unintentional weight loss due to loss of appetite. Just can't force yourself to eat anymore. You're losing 5 pounds, 7 pounds. You're not planning to lose weight. That's a worry. Difficulty making decisions, feeling indecisive, having difficulty reading and concentrating on what you read, and generally feeling hopeless. These are all would be worrisome signs that if you notice them in yourself or in a family member, should prompt a call for medical attention, that this might be signs of a more significant depressive disorder. I will say caregiving for a loved one with dementia is a challenge under the best of circumstances. We know that our family members who are caring for someone in the family, whether it's a spouse or a parent with dementia have had tremendous burdens, and there's tremendous stress along with that. During COVID-19, it's been amplified because medical daycare centers and senior centers that provide respite and structure and plan and activities for loved ones to go to have been closed. For those families who have been able to have aides coming to the home, there's been a lot of worry about that. What if the aide gets sick? What if the aide has the virus? Should I have people coming into the home? How many people? How do I monitor that? That's added an element of uncertainty and anxiety. And as a result, our families are providing more 24/7 care, and there are fewer options for respite than they have been before. There have been a lot of challenges for patients who are cognitively impaired at home. Without medical daycare programs or senior centers, they're facing often a lack of structure. Going to programs has been a nice way for them, a place to go, a familiar plan, a familiar place with activities, with social stimulation that now is lacking. So many of them are feeling bored. They're more sedentary, getting less exercise. While there are virtual programs, sometimes it's difficult to access them. And change in routine itself is stressful and can lead to restlessness, agitation, and more anxiety among individuals who have dementia or cognitive impairment. Many of them have difficulty understanding the need for physical distancing and the need for masks, and that can make it challenging when they're part of a family. So my recommendations for families who are providing this sort of home care for an individual with dementia, again, is to really focus, for you, it's more important than probably any other group, on the importance of structure and routine. Think of a daily routine for your loved one that includes some regular amount of daily exercise, whether it's watching a chair exercise class on YouTube, or whether it's walking with you or with somebody else outside if the weather is great. Activities that might involve some crafts, might involve some puzzles, maybe listening to music, maybe watching movies, musicals, TV shows that are enjoyable, planned social media gatherings, if you can set them up on Zoom or FaceTime, to be able to talk to siblings, to be able to talk to other children who may be out of state, and talking to grandchildren. And I think it's very important for all of us to really continue to work on improving our literacy for use of technology that really is out there. And I've been impressed because back in March, as I mentioned to you, our geriatric psychiatry outpatient clinic went completely from 100% in-person appointments to 100% telemedicine. And in the beginning, our patients and their families were at sea about this. As we were learning, they were learning. In the beginning, only the minority of our visits were done through Zoom, through video visits that might be with FaceTime, or through the Johns Hopkins video visit chart that we can do through the patient log, a patient portal. 10 months later, I've been really impressed. We've worked really hard to guide our families, to teach them how to improve their skills to use Zoom, to use video visits, and now it's the opposite. The minority of our patient visits are by phone, and most now are using virtual technology, and it improves the quality of the telemedicine appointment. But use of technology can really improve the quality of the day for you and for your family member. And as well, although I said respite opportunities are much fewer and far between, I do think you should try to look into what those opportunities might be. It might be the advice that I gave actually just last week to a family member, that maybe somebody else can come and stay overnight so that you can go away for the weekend, or that you can get away overnight and go somewhere else, even staying in a local hotel, just to give yourself a day away to recharge your own batteries. What are the virtual connections and resources? Again, I've spoken a lot about telehealth visits, but I also want to mention the Alzheimer's Association has virtual support groups, and these can be very helpful to families. If you go to www.alz.org, you will find it. This is the particular link for their online support groups. They have a lot of online resources. There are virtual senior centers, and I don't know what you have here in Boca Raton, but I know in Baltimore, a very popular senior center in Baltimore called the Meyerberg Senior Center has a virtual senior center, and they actually allow members from out of state, anybody to join. They have over 50 virtual activities a week. They have classes, they have exercise, they have all kinds of things. As well as there are a lot of virtual resources that include tours of museums in this country and around the world, zoos, TV shows and classic movies. One of our psychiatric nurses who works a lot with families who have family members with dementia put together a list of resources that she found, and she shared them with me, and I'm going to show you on the next 2 slides, and I'm going to make these available to you. But as well, you also could Google them, which is, you could Google chair yoga for dementia, and there's a YouTube about it. The National Institute on Aging also has physically active ideas to do for family member with Alzheimer's. You can Google Tai Chi for seniors, and you'll see a nice walkthrough on YouTube about this. Chair exercises for seniors, how to get started. There's a lot that's out there that if you Google it, you will find that can be very useful to families. And here's just a sampling of other virtual resources that are out there. Frank Lloyd Wright, virtual visits of his homes. This one, I like this, lockdown activities for an aging loved one from agingcare.com. You can find free online classic TV shows, classic movies, and concerts. This is nice, called the Violin Channel, living room live stream concerts from around the room. So all of these can amplify and provide some structure and provide some variability to the day that can be stimulating and fun. I think there are particular challenges if you have a loved one in a nursing home or assisted living. What do you do then? Here, I think it's important to really try to transmit to the staff information that you want them to know about your loved one who are caring, because if you can't get there yourself, such as what does he or she like or dislike? What is her preferred name? What are her hobbies she used to enjoy, habits? What helps him or her calm down? If you can't be there, write it out. Make sure you send it to them. Find out who it is who is on their nursing staff, who's working mostly with your loved one. And schedule time with that individual. I've been able to do telehealth and telemedicine visits with my patients who are in assisted living and even in nursing homes by having the contact of a nurse there who has a smartphone, and she'll contact me, and then I can have the appointment. No reason she couldn't do that with a family member as well. And then I think again, finding as many ways to let your family member know you're thinking of them through notes, cards, photos that you send. And when outdoor visits are available, to schedule them as appropriate. And sometimes it's possible to be able to see that individual on an outdoor visit in a garden, for instance, if everybody's wearing a mask and staying 6 feet apart. I want to talk a little bit about cultivating resilience, because I think this is important for our aging family members, but for all of us. So it might surprise you, but early studies actually were done back in June. There was a survey done by the Centers for Disease Control in June, which actually did a survey of a number of individuals at different ages, and they found actually that rates of anxiety, depression, and stress were lower in adults 65 and older than younger age groups. That might surprise you. But this was actually corroborated by a few other surveys done by others as well. Now, these are early on, and I haven't seen more longer term follow-ups, but at the time, there was the suggestion that perhaps, of course, some older adults were having a hard time, but not everybody was. It's more of a mixed picture. And this goes along with my sense of what I've seen as a psychiatrist as well. And perhaps some older adults may have more resilience, the ability to bounce back, to manage uncertainty and stress due to having coped with other life experiences along the way. What are the characteristics of those adults, older adults, who are managing relatively well? Well, for me, I would say among the individuals that I know and the patients I know who are managing and doing relatively well are those who were easy adapters to virtual resources, who maybe in the beginning were frustrated with Instacart, FaceTime, and Zoom, but stuck with it and kind of can do them now most of the time. Though they're doing better because they're staying connected with family. They're feeling that they have independence, that they can get the groceries they need. They tend to be people who are in relatively good health and perhaps have what, there's a psychiatrist, a geriatric psychiatrist in California named Dr. Dilip Jesti, who writes a lot about the protection of wisdom. And what he was referring to wisdom in older adults, it doesn't mean just being wise and knowledge, but he sees this more as a larger construct, which includes having a sense of empathy, a compassion towards others, the ability to self-reflect, regulate one's emotions, be able to accept uncertainty and tolerate ambiguity while being decisive. A lot of different components that he calls are elements of wisdom. And he talks about this because he feels that wisdom is not something we are naturally born with, but something we can cultivate in ourselves and that will help our older patients and all of us cope better with stress and uncertainty. So what are strategies that help promote resilience? And these really are in two categories. One are proactive coping and pro-social behaviors. Proactive coping are something I talked about before, which involves preparation and information. When you are informed about something and you know and you feel like you have more knowledge about it and you can prepare for it, you develop a sense of your anxiety level goes down and you are better able to cope and adapt. As well, doing things that are pro-social, things that enhance compassion and we know improve well-being. And this is something that even our older family members can do. They can call a friend who lives down the hall, who lives down the street, somebody in another city, expressing an interest in someone else and hearing how they're doing makes them feel good and makes us feel good. And I think staying socially connected in every possible way diminishes loneliness. And I'm recommending to take advantage of every way possible to stay socially connected through virtual means, through writing, but also through the telephone, which also still works. And so maintaining social connections while physically distancing, I think, is important for all of us taking care of older family members, but for ourselves, improving our comfort level and skills with technology, making use of social media so that we can stay connected, using email, snail mail, regular letters, phone calls. I'm going to mention another one. This is an interesting one. We hear a lot about kids and in school-age children and families forming pods together, but I've actually heard of seniors, and there's an interesting article, again, that appeared in our local newspaper. These are two retired professors who formed their own senior pod to ward off isolation. They didn't have children in town, and they decided that they were going to get together with another couple who they felt were just as scrupulous with hand washing and social distancing and staying away from venues that could increase risk for COVID-19, and they are socializing with them. You'll see it says expert opinions differ on whether it's safe or not, so I'm not going to say that I endorse this, but I will say it is a thought of how to ward off isolation. I want to go back to this, just to update you again on the vaccine, because I think this is the biggest medical news of our times. It is truly a medical tour de force that we have now 2 vaccines really available in such an incredibly short amount of time. You know, the Pfizer vaccine has FDA authorized emergency use, happened on Friday. It was all over the news yesterday, pictures of the trucks, the airplanes that were ready to take the vials of the vaccines all around the country to all 50 states. And Moderna, we're expecting very likely the same thing to happen this week. It is amazing. And I can tell you this week, I know that Johns Hopkins is scheduled to receive 975 doses of the Pfizer vaccine, and they're going to start vaccinating. Not all of us, obviously, not all the healthcare workers. We have 14,000 medical professionals, so 975 only will do the beginning, but it is the beginning. And yet, we have to be cautious because remember, this is another article that came out. Americans are paying the price for Thanksgiving. This is a picture here of LaGuardia Airport showing all of the people. We know that a lot of Americans did not heed the advice for staying away from others over Thanksgiving. And this is a graph from the Johns Hopkins Coronavirus Resource Center that really shows each of the months. And we see in November the tremendous spike in the number of cases that we've been seeing in November that is continuing to go up and probably will go up this week as we're experiencing the continued spike after Thanksgiving. And so I will say we have to remain vigilant. You know, to summarize, COVID-19 has certainly been the unique challenge of our times, and I would say our generation, but it's really of our century. The last time we had a pandemic, none of us were here in 1918 when there was the global Spanish flu pandemic. That it has had a heterogeneous impact on older adults. Some are doing relatively well, but there are many others who are really suffering and have had suffered due to losses, due to social isolation and loneliness, depression, anxiety, additional challenges of managing a family member with dementia. Vaccinations are heralding the beginning of the end, but it's just the beginning. And I think we still need to be, we can't become lax in following good public health guidelines. And so over the next months, we are going to still need to follow through on things that, many of the things that I share with you today in order to improve our coping during the months ahead. So thank you very much. Those are the things I wanted to share with you, and look forward to hearing from you.
Thank you, Dr. Lehmann, very much. It was very, very informative. You certainly brought home that some of the things that we've known are good health promoting behaviors during bad times come from really what we've learned through the good times. Eating
Absolutely.
well, getting enough sleep, the importance of socializing. And I think you really emphasize the importance of socializing for the elderly. And that's a social challenge. On the good side of things, we have more elderly than we had years ago. But the importance of programs, and I'll speak to JFS's programs. We have a senior center called the Weissman Delray Community Center. And it's a vital, incredibly wonderful opportunity for older people to meet others and to socialize. And they have dances and activities and all kinds of things. But we're doing it differently now. Right now, things are online. And there's lots of resources there. And we encourage everybody who's local to reach out to our JFS. If you look in the chat, we actually have we posted the email address, but the woman to contact is Risa D'Amato, and her email is risad@ralesjfs.org. And to contact our JFS for a lot of these needs that you've been talking about with us tonight. And for those in other communities, reach out to your JFS and to other agencies like this in your community, because it's amazing how much people have stepped up to provide alternative ways to provide what we know is important to people, the need to be with other people. So I'd love to hear what others are doing in other communities, or to hear any questions that people might have for Dr. Lehmann.
I will add, you know, for those of you who are living in Boca Raton, how fortunate you are to be in a place where the weather is beautiful. I didn't hear what the temperature was today, but I heard it was a beautiful day. Whereas I can tell you in Baltimore, the weather was miserable, very cold and rainy, and we're expecting a snowstorm on Wednesday. And so the opportunity to be able to be outdoors, to do some walking outside, of course, I'd recommend wearing a mask, I think is fantastic to be able to do that. And perhaps, I don't know what the local guidelines are in terms of restaurants, if it's possible to eat outside. We're struggling to do that in Baltimore because of our weather, but if you can do that in Boca Raton, how wonderful.
We have a senior living facility on the campus where our JFS is. And I can speak to that out of personal experience, not just professional experience, because my dad lived there for about 3 years. And we were reluctant to think of providing him care outside the home, but he blossomed in this congregate living environment. We think it gave him years more life and better quality life. And it really spoke to the importance of socializing, that at all ages, people need people. And we need to remember that, and that it's so hard to accomplish nowadays, but we're able to do it, and we're learning new skills, and that's good for us too. We're learning technology. We've been forced to develop new skills, and that helps us also. So out of the bad, we have to find good and learn about what we all need as human beings to survive well with each other. So we certainly appreciate, Dr. Lehmann, your being here with us tonight and talking to us about how to make the best of this. And the vaccine is coming, and that's pretty good news today. The first injections in Florida happened today, so.
Oh, that's wonderful.
So, so Sheila, there's a couple questions in the chat. I don't know if you're seeing it. One question is from Robin Siegel, and the question is how do you feel about moving an elderly parent during this time from their home to an assisted living facility, especially with the restrictions still in place?
I can't speak to the individual circumstances. I don't know what it's like or what's prompting those decisions. I think I guess you have to weigh the pros and cons of where they are and what their needs are in terms of where they're going. In a way, I would say a month or two ago, I might be more concerned if it meant that being in the assisted living, the individual would be more isolated. You have to prepare. If you go to the assisted living, your family member will likely be on a 14-day quarantine period, and nobody will be able to come in for 14 days. After that, it may change. With the onset of vaccinations, and knowing that a priority will be for individuals in nursing homes and assisted livings, that might change things very much. And so I think there's a lot to think about. What are the needs and what would be the circumstances? Is this the right time? Could it wait a month or two? If it is right now, could your family member do okay with a 14-day quarantine period when you're not going to be able to come and see them? I think those are a number of different things to think about.
Dr. Lehmann, there's some questions about the vaccine and your medical opinion about the vaccine came about quickly, although we know it's been years in the coming in terms of researchers working on it. But people are concerned about the long-term impact on taking the vaccine. So could you comment about the safety as well as the efficacy of the vaccines?
Well, I don't know much more than you know about it. I can say the Pfizer vaccine was studied in 44,000 people. That's a lot of people. 44,000. It wasn't 200. It wasn't 3,000. And of the 44,000, it did include a sizable number of individuals over the age of 65. I don't know how many. It wasn't 44,000 people over the age of 65, but it did include older people who had other coexisting medical problems. We know that we've had follow-up for 2 to 3 months now. We know how people have done with it. We don't have years of data because these are brand new vaccines. So we don't know. Will there be a lasting immunity? Will it be like the flu vaccine that you have to get it again every year? Or will it be other kinds of vaccines that you need to have booster shots for every once in a while? How long the protection is, we don't know. I mean, we're closely monitoring and closely studying it. I think the side effects have been very mild, and they are kind of natural, expected ones that we would expect to happen, which are some soreness at the site of the injection. That's normal. Feeling maybe a little achy and fluey for 24 hours. That's expected. That's a normal effect. That just means that the vaccine is working and activating your natural immune system and building up your own antibodies. It doesn't mean that you're getting sick with COVID-19. It's a good feeling, and it doesn't give you the virus. And those we know that it's very temporary and goes away in about 24 to 36 hours. So we will be studying it for years to come, but I think it is a miracle that we have these vaccines. And, look, we've had new vaccines have been developed over the decades, right? Starting, we've had the polio vaccine, we've had rubella, we've had mumps vaccine, we've had the chickenpox vaccine, we've had this vaccine for shingles. And there was initially a vaccine for shingles, and then a better one came out a number of years ago. So that if you have the first one, it's recommended you get the second one. So I think we have a pretty good track record with vaccines in general in this country, and that the longer they're out there, the more we learn about them, and we learn about which ones we need to, we study what their effects are, and what we need to do in terms of how well the immunity is that they bring. But there's no question that the Pfizer vaccine is effective, and I think Moderna is really up there as well.
There was another question in the chat, and the question is from Susan Schneider. She says, my 88-year-old mom has been a voracious reader her entire life. She lives alone, isn't in good health, but she tells me she doesn't have the focus any longer to read. Can you advise me how to encourage her to read? Thank you.
So when she says she doesn't have the focus, we have to wonder, what is it? I wonder even if it's a visual problem. I think, over these months, a lot of seniors have put off appointments, for eye appointments. Maybe she needs a new pair of glasses. There are a lot of books on tape. And then there are also large print books that you can get from libraries. And I certainly would consider doing those if she loves to read. I have a patient of mine who is blind, and he just always was a voracious reader, and now he's had a late onset blindness, and he can't actually read, but he tells me he's reading because he's listening to books on tape. And he spends as much time following a book on tape as he would in reading a book. And he gets them from the library, he gets, up to date new things that are coming out. He's better read than I am with books on tape. So that's another option, but I would also consider scheduling an appointment with an ophthalmologist too.
There's a comment in the chat about also joining a book club, which would be socializing as well as the pleasure of reading a book. So and JFS actually has a book club, and people are welcome. So if you go on the chat, you'll see the email on that too.
Yeah, and is it virtual? Is it on Zoom or?
Yes, part of, because everything at Weissman now is virtual.
That's great.
Yeah, that's our senior satellite in Delray. There's more questions. There's lots of questions about vaccine worries and about getting the pneumonia shot or the flu shot along with the COVID vaccine. What's your opinion on these multiple vaccinations?
I think there's no question that everybody should get the flu vaccine, and that the COVID-19 vaccine does not protect you against the flu, and that we have every year. And so absolutely to get both. They protect against very different organisms. I would think it would be important to be able to do all of them. The best time to get the flu vaccine is in the fall. It wouldn't be inappropriate to get it now, but usually people have gotten the flu vaccine in September, October, or early November. I think absolutely, because it would be, there still is a risk of getting the flu, and there still is a risk of getting COVID-19. Very interesting though. There were studies that reports were coming out early in the fall about what was happening in the Southern Hemisphere, because they're 6 months different from us, right? So very interesting is that during July and August and September, which was summer for us, but winter in the Southern Hemisphere, they were seeing lower rates of the flu. And the reason why they think is because to protect themselves from COVID-19, they were wearing masks. So masks were helping to prevent not only transmission of COVID-19, but helping to prevent transmission of the flu. So that's not a substitution for getting the flu vaccine. I still recommend it, but it is, because you wouldn't want to get both. You could very well get both. One doesn't prevent you from getting the other. But very interesting that wearing a mask would certainly also help diminish the risk of getting the flu as well.
That may be our future. Judith Levy has asked a question specifically about the pneumonia shot and how is there any contraindication with getting that and the COVID vaccine?
I don't have any information about that. I'm not an expert on that area. I would recommend you talk to your family doctor about that. I haven't heard anything, but I haven't, I don't have particular knowledge about that.
But we definitely know if you haven't gotten your flu shot already, you should, and you want both the flu shot, and when we're able, we'll get the COVID vaccine too.
Hmm.
And then a day will come when we'll all be able to be together again.
Here was another question in the chat asking, can you comment on the mental health stressors of the staff working in nursing homes and assisted living facilities?
Wow, I think that they have been the underappreciated care providers of this whole pandemic. No question about it. They have been underappreciated, and they have been under tremendous strain. Early on in the pandemic, people were not thinking about the residents in nursing homes. They were not thinking about the staff. There was early on a prioritization for personal protective equipment called PPE, for physicians, for nurses in emergency rooms, in hospitals, but not for individuals in nursing homes. Very early in the pandemic, there even were policies. New York State, this is true, had a policy in March that patients who were recovering from COVID-19 in hospitals should be transferred to nursing homes to continue their recovery, but they were still contagious. And the nursing homes were not prepared to isolate them or quarantine them or have the PPE, and then other residents were infected. So they were not considered early on in terms of their needs for PPE, the needs of the residents. And I think even now, in terms of general mental health support, I would, healthcare providers on the front lines, to be honest, are feeling a strain and feeling exhausted, particularly with the current surge. I showed you that graph, right, where you saw that huge upshot in cases. That's going on across the country. We're hearing in the news about hospitals filling up with patients. Nurses, doctors in hospitals are getting exhausted, and staff in nursing homes and assisted living are getting exhausted. And sometimes there are staff that are calling out, and there are staffing shortages, and it's been very challenging for them. No question about it. No question about it. I think, I don't work in a nursing home or assisted living. What I don't know is how often are they doing a mental wellness check-in with their staff? I don't know. I will say Johns Hopkins is very worried about it. Just today, and this happens probably once a week, I get an email. I'm a psychiatrist, right? I get an email, as well as all of the other healthcare practitioners at Johns Hopkins, asking me to do a survey as a check-in. How is my mental well-being? Can you imagine that? They're sending an email to me, a survey, to find out how I am. I mean, that's very nice that there's a sense of caring. I don't know that that's going on in nursing homes and assisted livings, that people are even asking the questions and checking in on them.
Thank you. And here's one more question. It looks like it might be the last question. This is from actually one of our care managers. She says, as you discussed, I have observed significant decline in memory and in mental health in senior clients who live alone and had some cognitive issues pre-COVID. Families ask if their parents will rebound once we get back to normal life, or if the decline is ongoing.
I don't know. Good question. I think we will have to see. I think that has been a common observation that just shows really the importance of stimulation. I don't know if it's an element of the isolation, not getting the social stimulation, the feedback, the discussion, the verbalizations, or whether it's also an element of stress, of sadness, of depression, exacerbating, that people are feeling more hopeless or feeling like they don't see an end to this. Particularly if you're cognitively impaired, it's hard to remember from day to day how long this has been going on for, when is it going to end, what it's all about, why isn't my family calling, why aren't they coming by? So every day it's a little bit of sort of an injury over and over again, of feeling like, oh, that they're not here. Maybe they don't remember they called yesterday, so that could be exacerbating it. Those are really tough situations. We don't know all the factors that are there contributing. I'm an optimist. I certainly hope there is rebounding, and that, once there is an amelioration and people can get together again, and there's vaccinations and there's a loosening of restrictions, that we will see improvement. But my guess is that some people will rebound, and I predict some people may not. That this might be propel them on a trajectory that may not rebound as well.
You've given us a lot of tools to use with people, and hope that those things will work on the other side of this too. Thank you.
Thank you. Well, thank you so much for your interest. Thank you for having me, and I wish you all the best for happy holidays and a much better 2021 than
Thank you,
2020.
Dr. Lehmann. We wish the same to you.